we got to the interviews, and then you'd have your own slot. Most of the time, the interviews were actually in person because COVID hadn't occurred yet. But you would just have your interview, and then you come out, next person comes in. It was like very like fast paced. And I think the interview lasted an hour or less than an hour to an hour. But there were like 6 people on the panel, and it's like the people who are involved with the neuropsychology program. So the director, the supervisors, and all the people who help with like making sure that the program is still like running. So 6 people in total, and each person asked like a question, and they asked like questions.
Ladies and gentlemen, friends, colleagues, thank you so much. I am so excited today. I managed to get someone who's going to introduce herself. She's in neuropsychology. I don't want to take much from her. I'll allow her to introduce herself. Ma'am, welcome, and briefly, just give a brief introduction about yourself, where you come from, and what's your name, so that we can get to know you. Welcome, and over to you.
Thank you. Thank you for having me. My name is Nwabisa Mlandu, and I am currently an intern neuropsychologist at MEC Kalane Incorporated. And basically, we work like with private practice at a private hospital in Cape Town, and we also have offices in Pretoria and Durban. So we work mostly in South Africa, like we are widespread. And where I come from, I am from a small town in the Eastern Cape, Mount Fletcher. Most people don't know where that is, but they always know Imatatiele, and that's where
Yes.
They're always like, come to Matatiele, it's 60 kilometers from there, and then they're like, oh, okay, we know that place, so that's how they get there. But it's a small, nice, like intimate town. So yeah. But I went to schools in different provinces, so I've mostly like lived everywhere, like rural, urban, and in different contexts. Yeah.
Thank you so much. Maybe just briefly, with your education background, what did you do for your undergraduate? Did you do a BPsych? Did you do psychology degree? What did you do undergrad?
So that's a bit of a story, because when I initially like applied to university, I wasn't quite sure like what degree to go into, because I knew I wanted to work with people. I always loved life sciences, and I was good with maths and physics, and I was like, I want to work with people. But then because my mom was a nurse, the one career that she knew was just like being a doctor, so medicine. She was like, I should apply for medicine. And that's when I did apply for that. But unfortunately, I did get a conditional acceptance with my grade 11 marks. But then when the matric results came out, that was taken because my marks like dropped from the grade 11 marks. And then I had to go into like a year. I took a whole year where I took a gap year, but it was not intentional. So my mom heard from this governmental worker that the Department of Education would be offering like scholarships to China for medicine in the Eastern Cape, but we would only start the year in September that year. So I finished my matric in 2014, and then 2015 was when I was supposed to start university. And that's the year when we met this governmental worker, and he was like, oh no, we have these scholarships that they're starting out in China, students can go apply for medicine there. So he did the whole process for us. So the whole year I had to wait until September, because that's when the semester was supposed to start. But I had a feeling that there was something a bit off here, because I've never trusted the government to show up with funds. So I was like, let me apply.
Yeah.
Make sure I apply university at UCT, because I always wanted to come to UCT. Not sure why, but it was always a thing I want to go to UCT and be far and just spread my horizons, be somewhere new, because I've never been to the Western Cape before. So I was just okay, let me apply, and then we'll see. September, if it happens, then I'm gonna go. But if it doesn't, then I know I have an option. Like for the next year, I can go to school, like go to uni the next year. So I applied, and then I got in for audiology. I didn't even know what audiology was, but I was like, I want health sciences wherever, and then I'll get there and discover what I like and what I am more leaning towards when I get there. As long as I get to the university and get the acceptance there, I should like be fine, because I was still not certain what I wanted to do, but I knew I wanted to work with people. So I got into UCT, and then that year, the government, they told us that no, unfortunately, there were no funds in the Eastern Cape, so that China whole deal just went. And then luckily, I had applied, so UCT took me, and then the following year, 2016, I started my first year, and that's when I was doing audiology. But then when I got to audiology, we had like a psych, we had psych like courses that we took, because most of the health and rehab students took like psych courses. So we took some psych courses, and we were doing like psychology for like 3 years. I think they do psychology the first 3 years of their degree. So that first year, I did psych, and I was like, this is more of what I want to do than like the audiology side of things. So I was like, oh, actually, this sounds more like what I want to do. Like I love the brain. I've always wanted to learn more about the brain. I wanted to know more about the connection between the mind and the body, how the brain like leads to like mental processes and all of that. And just specifically focus on the brain, because I love this. Like there's a lot to discover there, and you will never know everything. So okay, this is what I'm leaning towards. So first semester of first year, I changed my degree. So I then registered for a bachelor's of social sciences in psychology and philosophy. So I chose the two because the mind-body problem. So I know philosophy is like more like theory-based, but I thought it would help me in understanding like the practical side of psychology, because you deal with a lot of like knowledge that explains the processes that happen before like thinking, the processes that concern thought, everything that has to do with like the thinking process. Like philosophy explains a lot of that to some detail that inside you just get the practical side most of the time. So it's nice to have that background. So I was like, oh, okay, this sounds like an interesting choice. So I took philosophy and psychology as my majors, and completed my 3-year degree in a bachelor's of social sciences in psychology and philosophy. And luckily, I got a distinction in psychology.
Wow.
And really?
Wow.
And that was still UCT. So I was still at UCT. So the 3 years, so 2016, 17, 18, and then I got my degree. And then I applied for the honors in psychology at UCT. So that's the Bachelor's of Social Sciences honors, and got in for the following year after completing my 3rd year. And then that's when 2019 I was completing my Bachelor's of Social Sciences honors at UCT in psychology. And I was also lucky there because I passed that with distinction.
Wow. Wow. It's good to speak to a distinction student here.
But it was intense. The honors year was like the most intense year I've ever had in my life, because it was like too many things happening in 1 year. You have to complete the thesis, you have to complete all your work, like your coursework in 1 year, and it's like a very like condensed year. You have to do everything in 1 year. So it was quite like a high pressure situation, because it's just 1 year and you have to complete all of this. So
but you still got distinctions.
Yes. I think I've always like made sure that.
Wow. No, that's inspiring, Nwabisa. There are few who get distinctions at honors. Honors is hectic.
It is. Yeah.
No, that's inspiring. Okay. Before you get into then your masters, I want to get to know. And I'm so happy that you are here, because I told you before the interview, I've been getting a lot of questions about neuropsychology.
Yeah.
And I want to know, because if I remember correctly, neuropsychology was introduced, I can't remember which was it, 2017? No. Actually, it was about 2018, 2019, I think. How did you get to know about it? Because I know it has been happening in the background, but it was not official at HPCSA. They had to actually go to court. There's a video I did about that. But how did you get to know about it? And decide this is my path?
So that's also like it's also been like a discovery throughout the journey. It's not something like I had planned initially, because coming straight out of like high school, I genuinely didn't know that neuropsychology existed. I didn't know the specific career that did what like I was passionate about, because I knew what I wanted to do. Like I want to study the brain, I want to make all these discoveries, but I also want to work with people like in a clinical sense, not just like work as a scientist, like working with the brain, like. But I was like, what career? What career can I go into that does like, all of these, that encompasses all of these things? So I was like, okay. When I got to psychology, then we had like the biopsychology and all those classes. And then we'd have like scenarios where they talk about like a neuropsychologist was doing this and this and that. And I was like, this is like the sort of stuff like I think I would be interested in. Like these are the conditions I'd like to study, like dementia, strokes, epilepsy, all of those disorders that they looked at. I was like, okay, this sounds like I would be interested in this line of work, but I wasn't sure like what that entailed until I think second or third year. So we had like specific courses that were like neuro related, like we had neurosciences or like introduction to neuropsychology in third year. Yeah, at UCT there's like a course called Introduction to Neuropsychology. And there they go into much more detail about like what neuropsychologists do, what are the different like cognitive processes that we look into and all of that. So I was like, okay, I did my own research after that, because I was like, this is what I would like to go into, because I knew about clinical psychology. That's the main like type of psychology I knew since high school. I was like, oh, clinical psychologists do this, but I didn't want to be a clinical psychologist. I was like, there's this specific niche place I want.
I get you.
Yes. So yeah. So I got there and I was like, okay, I did my own research, and then I found out like the whole process, and I saw that it's not like registered yet. Like you can't register with the HPCSA yet. So it was more like a very risky like career choice at the time. But I was like, I am passionate about it, so I let me pursue it, and maybe like by the time we get to like masters or wherever, we will be able to register. Or if it doesn't work out, then I can go into the more research related side of the work until the time when we can register as clinicians. So I just had the hope that eventually the court case would pass. Eventually, we'll be able to register with the HPCSA. So I was like, yeah, let me just let the passion like keep me moving, because yeah, I'm just operating on faith now. Like eventually it's gonna be sorted out. But
so which year was that?
That was like my third year. That's when we did like the in-depth like neuropsychology course.
That was in 2017.
2018.
Wow. So I think it was a year before it was actually wow. No, that must have been a big leap of faith.
It was a huge leap of faith, because at least honors, you still have like a choice. You still can apply for masters in neuropsych. So I was still in second year, so I was like, let me do my honors. So I applied for honors and then got in. And even in honors, there's a neuropsych course that you have to do in order to apply for the neuropsychology masters. Like it's like a physics, because they offer it at UCT. So I did that course, and it was very insightful. Like we had like a great teacher for that course. Like it's the neuropsychology course, and it focuses specifically on neuropsychology, and it's like a like intro to the master's degree. So it was quite insightful, and I was like, yeah, I am really not regretting my decision. But we'll just see what happens with the HPCSA in the future. But if it doesn't work out, I'll go into research, because I still want to build the knowledge about neuropsych, because in our country, I think there's a lack of that, because it's not really like, it's very new compared to other countries.
Not true.
Most of the knowledge we have is from Western countries, so it's nice to have our own like knowledge, because the cultural influences, there's many things that affect the brain that haven't been like properly like looked into, because the people looking at the actual like building the knowledge are not from African countries. So yeah, so I was like, okay, I'll go into the research. I'll go into the research if it doesn't work out. But then when I got to honors, I think it was September that year. I'll always remember, because it was just like a life-changing moment. So I think
can imagine.
Yes, September 2019, and we were in honors. And we were having one of our classes with our professor, and he was like, we just got a call from the court and stuff. They finally settled the case. They are opening the register soon,
Wow.
psychologist. And everyone
Wow.
was so excited in that class because most of the people there were hoping to apply for masters in neuropsychology.
Wow.
So
Wow. 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 Talk about being at the right place at the
at the
right
right
time.
time. Yes.
Wow. 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 That's very inspiring. And I told you that we are in a season for selection now. I think one institute has already opened their selection, the application. I think 24th of March. Others will be opening anytime from next week in April and onwards. So we've got a lot of students who are planning to apply to get into masters, and I want to focus particularly into masters into neuropsychology. You have traveled the path, and I could already hear that you have a lot of passion for it, and I think then you become the best candidate to speak on this particular topic. Maybe if you can just take me through how was the application process and the selection process into neuropsychology. Just take me step by step process that anybody who want to apply can understand the process.
Okay. So, firstly, Doc, I think the application process. So the application process like entails like three different things. I remember there was like I made an application to UCT directly, and then there's also like the psych department application. So those are two separate things, and I think sometimes people get confused because they forget to apply to the university directly. They just go through the psych department and then forget to apply to the university as a whole. So I think you have to do those two separate applications for the university and for the psych department. But it should be on the website. People should make sure they check the psych website at UCT. You'll find all that information there. And then apart from the application, the online application, you also like send a motivational letter. So
Mm-hmm.
that is like, yeah, separate. And then also you have to, yeah, that's the motivational letter, the application. Yeah, it's actually two things. And then the motivational letter, what I would advise is to make it like personal, like not make it like a generalized motivational letter where you're just saying, I would like to have this job because you have these qualities and all of that. I feel like personalizing it a bit, like about your own experience and how you came across your passion into neuropsychology makes it like more like human, like more you can feel that this person has a passion for this
Sure,
because
for
they have
sure, for sure.
experiences. Yes, yes,
Yeah.
yes. I feel that makes like that gives you the edge. Make it personalized and not just say what's interesting about neuropsychology and what
Mm.
you want to venture into, but you can include those, but also make it personal to you because that's what you are passionate about. And yeah, that's what I'd advise for the motivational letter. And
Mm.
then I think you do also write a CV. It's been a while because I don't
Yeah.
remember well, but I think the third thing is the CV. I think you
Is
have
it?
CV or something, or
Okay.
references. Yeah, it's either CV or references. Like
Probably references.
yes, yes, yes. So I remember I put my two supervisors for my thesis as my referees. So they were the ones that wrote references for me. So I would recommend that, like having people who are in academia like vouch for you and what you are capable of.
Mm.
Yeah, because that degree also like entails like 50% research. So it's
Mm.
50% clinical and coursework, and then 50% research. So they
Mm.
also know that you have the research capacity to like do a whole master's thesis. So that also helps you with that. And then after submitting all these three things, you will probably, it depends on people who applied, but sometimes they call you in for an interview. And then for the interview, they also look at these three things as well as your marks, like what you've been studying, how you've been doing in university, and all of that, in order to determine who are like strong like candidates for the master's positions.
Mm.
And then they call people in for interviews. And then the interview process is also like...
Before we get to the interview process, do you by any chance remember how many people were there called who came for the selection?
Whew, that's the one thing I have never gotten a number of. I remember I just got there on the day, and it was one day. Like we all were interviewed in one day. I think when it was us. So
but
you just...
Would you say there were more than 20, 50?
Not...
Because I would assume it was not known at that time. So I'm wondering the attraction, was it that big?
I think there was a big attraction, especially because we got you could register. That's the year that we could finally like register with the HPCSA. So people were like, oh, okay, it's no longer like as risky as before. So they apply. So the applications themselves, they always used to tell us that there are many people that applied, but the actual interview, I think they interviewed probably 20-something people.
Okay.
It was never more than 50 because it was just us, and each person had a slot throughout the day, like a full day of interviews, and then we would get...
That was a fair number.
Yes.
Yeah. Okay. Super. Then please continue.
And then, so we got there, we got to the interviews, and then you'd have your own slot. Most of the time, the interviews were actually in person because COVID hadn't occurred yet. But you would just have your interview, and then you come out, next person comes in. It was like very like fast paced. And I think the interview lasted an hour or less than an hour to an hour. But there were like 6 people on the panel, and it's like the people who are involved with the neuropsychology program. So the director, the supervisors, and all the people who help with like making sure that the program is still like running. So 6 people in total, and each person asked like a question, and they asked like questions, whether it was like a personal question, like what are your weaknesses and how are these going to affect you, like your clinical like work and all of that. Or it could be like general neuropsychology questions, like what are you interested in neuropsychology? What field do you want to like specialize or like focus more on? And I know with me, I've always wanted to dive into like cross-cultural research and make sure we have like the tools that are like culturally appropriate for South African use, because most of the IQTs, the batteries you use in neuropsychology, are all developed like in Western countries, and sometimes that can like affect like the interpretation, because you'll think the kids here will perform the same as the kids in the US. That time, no, our education system is different. So they might not know some things that they know there, or we might know things that they don't know there. And all of these things have never been like studied to that extent. So I was like, I'm interested in like making sure it's more like African-centered neuropsychology. It would be great that centered to these populations, especially the clinical populations, because misdiagnose or pathologize people when they really don't have pathology, stuff like that. So I was like, that's my field. I want to like dive more into that, to learn more about that and try to build the knowledge there. And they would ask questions like that and all of that, and why you want to go into that specific part of neuropsychology. And then I think they also ask like some very like reflective questions, like about you as a person, like what are your shortcomings and all of that stuff that would make you like clinically incompetent in some way. Like maybe you are too sympathetic, that it would affect like your relationship with patients. You take too much from them, then that would affect your performance because you're not giving them the best service, because you're feeling too much feelings and not actually helping them in the same.
Any extremes in your personality?
Yeah, stuff like that actually. Yeah. They really try to get to know you and your personality, apart from the actual interests you have in neuropsychology, like who are you and your interests, what's your path, what's your background, why are you here? What experience do you have with working with people, for example? Like, do you have like the people skills that are needed for clinical work and all of that? And that's where they try to gauge like how clinically competent you would be in a setting, in a hospital setting, or wherever you have to work in the clinics. Yeah. So they ask all of those questions so that they have an idea. Yeah.
So that happened throughout the day, and so it was only just an interview.
Yes.
And what happened afterwards? Did you guys were released? Did you meet as a group, or there was a list outside? Go check your name there if you are selected, or what?
Not even, not even. After your interview, you just go outside, and then I know I had like friends who were also coming for the process because we were in honors together and we met in honors. So we just like discuss afterwards, like what sort of questions we got. We were like, oh, after the whole interview process, we were like, okay, these are the sort of questions we were asked, and like how challenging we found it, or what we thought about the whole interview experience. But it was basically informal, just us chatting like after the process. And then I think after 1 week, there was like nothing. They didn't tell us anything after that. They were like, we will let you know. We'll let you know after a week or so. And then I think after a week, they told us. Yeah, I think I was at work because I worked as a research assistant because I'm studying. I remember being at work and I was working for an intern neuropsychologist at the time.
Wow.
I had been telling her, I'm like, I applied, so I'm waiting, like the interview process, what happened. And then I got an email, I think after a week, and they were like, we are happy, congratulations, we're happy to accept you into the program. So I told her, I was just like very excited.
Wow.
It was quick, very quick after the process, like the interview.
Wow. Wow. And maybe just to come in there, so you were working for an intern research neuropsychologist, but as a research assistant rather.
Yes.
Was that part of your work, or was it just voluntary to prepare to get into neuropsychology?
So it was a bit of both because I was thinking like I wanted to have some experience working with like the type of batteries that they use like in neuropsychology and have that experience because we didn't really do much of that even in honors. Except my research study where I had to use a specific battery for the research. I hadn't had much experience working with like different types of batteries and seeing and assessing for different like mental processes, attention, working memory, all of that. So I was like, oh, when that opportunity came up, I was like, oh, let me apply because I've always had like student jobs since second year, I think. Yeah, I've worked at multiple student jobs since second year. So I was like, this is very like neuropsych related. So I really want to have like that experience. So I applied and I got the job and then I started working with, and it was her research. So this was her master's thesis. So she hired me to help with the research assistant position for her master's thesis. So I was helping out and it was great like for like building my knowledge about neuropsychology and also like as like work experience basically like being in the field and also like earning some income whilst I work towards like neuropsychology. So yeah.
Okay, and maybe just for just comparison, what is the common battery or common psychological tools that a neuropsychologist use?
Yeah, the ones that we use the most, I'll tell you about like the pediatric ones because adults, most of our clinical training is more like hypothetical deductive. So we use the batteries as a tool to find like, okay, this is the pathology, this is the clinical picture, and this is the mechanism that we think is happening. Yeah. So it's not like the main thing, but in pediatrics, we have to use them. We use very standardized like batteries, like the WASI and the WISC. We also use the WASI, the WISC, the NEPSI. We use the WIMS, the CMS. There are like multiple ones, but these are the common ones that we use. But you don't use like the whole battery for all. You just select specific tests to assess whatever that you are interested in whatever child that you are assessing at the time to see if there's a pathology, if there's anything wrong, or if they're still like high functioning.
Okay. Do you ever use the J size and S size?
That's what I just like encountered this year because we predominantly.
When you say this year, you mean at your internship, so which means you never use them at your master's level at all?
Really, in the beginning, not really. But it's I saw now that it's the similar test that we use, but it's different. It's like the different like stimulus and all of that, but it's the same sort of.
The ones in the WISC are basically similar to them.
Yeah, but we've never we use that as the main like tests that we.
Is it? Okay. And So you were then selected into the master's program after that week selection. So what did your, let me get to the master's program. What did it entail? Was it mainly theoretical? Did you have to see client? Was it within UCT clinic? I'm not sure how's UCT context. Did you have to go to a clinic? What was the common work environment that you had to go to for your practicals?
So with the master's program, the first year, which we call M1 2020, that's when COVID happened. But M1 was mostly like the coursework and your research, like getting your research proposal done, and making sure that you are able to collect data in time and all of that, so that that process doesn't interfere with your clinical training the following year. So M1 is mostly like the theoretical year. You learn about all the different disorders. You learn neuroanatomy, you learn neuropathology, you learn neuroimaging, you learn like the principles of clinical work, neuropsychology disorders. You learn like there's different courses that you take, some that are full year and some that are like just 6 months, like the half the year you learn about that, and then the following like semester you learn about something else. But yeah, and then pediatrics, you learn about the different pediatric neuropsychology disorders or pediatric neurology problems that you would be expected to see, and what sort of tests they usually use to like detect different things, and what sort of tests we should expect to use like in the next year for clinical work, and how to use these tests for that year in preparation for that year. So it was mostly like theoretical and doing the practical, like more training about the batteries, like learning more about the batteries, what you're looking for, how to set up a test plan for like a patient, like what would you use, which test, how you decide which test you use, because that depends on what sort of patient are you seeing. Are they high functioning? Are they low functioning? Are they going to be able to sit for like that long period of time where you're testing them for this? Or do they have like attentional difficulties that will make it hard to like do a whole battery? So you have to make sure it's like a summary of the battery, but make sure you make like good choices, like in choosing what test you need to use for a patient. So we learn all of that, like background, like theory and all of that in preparation. And also, yeah, the neuroanatomy, neuropathology, and neuroimaging course was throughout the year, because we learned so many different like mechanisms for brain damage, and the neuroanatomy itself, like the different of the brain and what they are responsible for. And then we learned about the neuroimaging, like what an MRI for someone who has like brain pathology looks like for different sorts of things like dementias and all of that, and how to differentiate between them. So we did all of that in preparation for M2. So M2 is our clinical year. And that's the year where we actually started seeing patients. And from beginning of that year, we saw patients, adult patients at Grooteskier Hospital. So it's the governmental hospital here in the Western Cape, great hospital. We saw so many interesting cases at Grooteskier.
Wow.
And we would also see patients at Red Cross, because it was like we tried to have like half the time you see adult patients, half the time you see like pediatric patients at Red Cross War Memorial Hospital. So those are the two hospitals we worked with throughout our training, was Red Cross and Grooteskier for adults. And that's the settings that we were at. Like we were just alternating between the two throughout like M2. And we, even in our internship, that was the same thing. Like we just saw patients, Grooteskier for adults, Red Cross for pediatrics.
And you are now busy with your internship.
Yes, that's what I actually completed this year.
Is it? When did you start with it?
So I started my internship last year, January, and it's a 1-year full-term internship. So started that at Grooteskier last year, January, completed it this year, end of January.
Is it? And what are you doing now?
So I am currently still registered as an intern neuropsychologist, because I'm in the process of getting my HPCSA registration sorted so that I get the independent practitioner designation. But yeah.
When are you writing? Have you written your board exam yet?
I'm writing them soon. I'm writing them soon. That's
Wow.
the whole process that's missing until I can register as an independent practitioner. So
Because I'm trying to, sorry, continue. Yeah, continue.
so right now I am still an intern neuropsychologist, and that's what I'm employed as. And that's mostly the HPCSA designation that, and I'm trying to get my board exams done soon and finally register as an independent practitioner.
Okay. And tell me, a typical day of a neuropsychologist, what do you do from morning until 4?
Yeah, so I'll just start with the internship stuff because that's the one experience I have, and that's
Yeah.
what psychologists do basically. So
Yes.
in the mornings we usually see patients, like I think two patients, two patients in one day, because it's quite a long process to do like the neuropsych testing and
That
then
sorry,
planning,
sorry, sorry,
doing the
Nwabisa, that's at the hospital, eh?
yes, yes, yes.
Okay.
So you get to the hospital and then you already like have a test plan, a history plan, let me say. So I know in clinical psych they call it an intake, but we usually call it a history. We're taking a history. So we usually plan beforehand. So if you're gonna see a patient tomorrow, the the night before, you already like have a plan, like what sort of questions you're gonna ask, because this patient presents with this sort of pathology. So you want to get more details about that. And maybe if you're trying to like differentiate between different disorders, for example, if you ask if this is like a Alzheimer's disease or is this a vascular like dementia, and you know how it differentiates through testing. So you want to get more information regarding like what the patient has and their whole medical history, their psychiatric history, if there's any other like issues or hospitalizations or previous head injury that they've had, just to have to exclude other like other pathologies in the process. So you get all of that, the background details, and also get like the collateral from the family. So that's us in the morning, like interviewing the patient, and then hopefully the collateral is there visiting for visiting hours. If they're not, we usually call them after like interviewing the patient to get like their own like description of what challenges the patient is encountering, cognitively, emotionally, psychology, behaviorally, just so we have like the whole profile. And then after that, we go to the actual like bed where they're sleeping. If it's an inpatient that we see, we go to their bed and then we assess them. So we take all the tests that we need depending on what we think they have, because we come up with a hypothesis beforehand. And that's how we've been trained to have like to think hypothetical deductively. So you have a hypothesis and you either prove that or disprove that hypothesis. So maybe you say patient has vascular dementia. So we'll expect them to present like with dysexecutive functioning. And then if they have Alzheimer's, we'll expect them to present with like difficulties with memory, like encoding memories, learning new information, all of that. So yes. So we take all the tests that will help us differentiate between the two. So you'll see that, oh, this is clearly like executive dysfunction. This is clearly a memory problem. So you have all your test plan, you have a test plan, and then you go into the room with all the tests you need. And then you gauge from the patient how they perform that. Oh, okay, this patient is struggling with this. So this is most likely to be like vascular or it's Alzheimer's. And you try to explain the whole process, like what is the mechanisms what is the mechanism behind that, like they have like maybe if it's executive dysfunction, they might present with like multiple pathologies, like they have diabetes or high blood pressure or whatever, like vascular conditions that might explain why they would have vascular dementia. But if you have like imaging stuff like the MRI or the CTB, then it can help us also to come to a conclusion. Like, oh, we're seeing these problems, so they're probably struggling.
Okay. So usually, I mean, with most psychologists, excluding maybe the industrial and research, following a diagnosis, we do an intervention, probably either therapy. What's your form of intervention after you do your diagnosis?
That is actually quite a hard question because at current it's quite like neuropsychology is more diagnostics, even in training. Like you learn a lot about the diagnostics, like helping with the differential diagnostics, helping with coming up with the diagnostic, with the diagnosis. But the actual like what do we do after is still a huge question that I think neuropsychology still has to like build up to working towards. But we do have like neurorehabilitation. We do have classes of neurorehabilitation, and they mostly like centered around like psychotherapy for people with brain damage. So that's what we've mostly learned so far, because that's the training that we've gotten. But the actual practical experience of doing the work, we haven't really. I feel like we do that after the internship. Then if you are interested in neurorehabilitation, then you take that more like you focus mostly on that and learn more skills regarding that. But the actual training itself is not centered around the neurorehabilitation much as compared to like the diagnostics.
I get you. I get you.
Yeah.
And how will you distinguish your role at the hospital to that of a psychologist, a clinical?
So at the hospital, we basically do we get referrals mostly from neurologists. So from my understanding, most clinical psychologists work with psychiatrists directly. And I think that's the same relationship we have with neurologists, they have with psychiatrists, because we get both of our referrals from the neurologists and some from neurosurgeons. But yeah, it's mostly like we are centered in the neurology department. We are part of the neurology department. And ClinPsych is part of the psychiatry department, I think.
I get you. I get you. So you never get to a point where you are part of the clinical team with a clinical psychologist?
Not really. We don't really work much with clinical psychologists, which was a bit odd because I thought we worked like closely with clinical psychologists. But once I started working, I was like, we actually look at very different like pathologies and different like types of things. So we never like intersect much because I know we sometimes see psychiatric cases just to see if there's any cognitive problems going on, or if this person has like more psychological problems that are explaining why they are behaving the way they are, or their thinking has changed. So we do those, but it's not like the main patients that we see. Most of the patients we see have like some neurological damage or some suspected neurological condition.
Okay. No, super then. Do you remember, I forgot to ask you, how many were you in class at the master's level?
So there were 7 of us for my class.
Wow. 7 is a very small number. Wow. Anyway.
6 a year, but we were lucky because there were 7 of us.
Yeah, wow. No, the number is, no, I know it's a big issue. The method of selection and how many people are selected for masters. It's a very big issue. No, anyway, thank you so much. I really appreciate what you have shared, and I'm sure anybody who wants to follow neuropsychology, at least they have learned a lot. You have given them a lot of background. But there are other maybe students or other graduates of honors in psychology who might want to follow in the same footsteps. I want to find out, maybe number one, for somebody to do neuropsychology, are there particular modules that they need to have at an honors level? That's number one. Or maybe just answer that, and then obviously there will be more information on the website, but maybe what you can know and share with them. But maybe in addition to that, I just wanted to share a bit with those who are watching, who want to follow your footsteps, maybe also get the distinctions as well. How would you advise them to be neuropsychologists one day and speak so passionately like you do?
Thank you. So firstly, about the honors module, I think that differs because some universities might offer some of these courses, but some don't have like neuropsychology as a course that they offer at honors level. So I don't think they're too strict about that. But if you went to UCT, I know you have to have done the Intro to Neuropsychology course in your honors year. So that's the main thing they ask for, like in terms of modules. You just have to do the intro to neuropsychology module, and that's it. But if you went to like, I'm sure if you didn't go to like UCT, they have like special like considerations for people who didn't go to UCT. If you don't have that course, then I don't think that should like disqualify people from applying to the master's program. Yeah, I don't think. Yeah.
Is it okay? And maybe before you answer that other question, we only know UCT as the only institute that offer masters in neuropsychology. Perhaps from your class or your lecturers, do you know of any other place, anywhere in the world, anywhere at some corner of Africa that offer it?
Not at all. Not at all. To the best of our knowledge, only UCT offers it in Africa. And
okay. No, awesome. Yeah, please, just a word of encouragement to those who are inspired by your story and want to follow your path.
Yeah, I won't lie. I won't even lie. It was quite a challenging path. Like at each step, you just feel like you have to work so much harder each time, and it's like you have to apply each time. You have to apply again, and there's like another like challenge that's waiting on the other side. Even when you get there into your master's in neuropsychology, you find that it's not as glamorous as people would think it is. Like it actually entails a lot of hard work, and it's quite challenging, like having to learn like so much within like 2 years and be like a trained clinician within that time, and making sure you're able to work with people in that short space of time. So it's quite like a lot. It requires a lot from you personally. So I would encourage people to definitely apply for it, but make sure that you are resilient enough to like go through the different like stages, because you are also tested, like your character is tested throughout that whole process, from honors to masters, even throughout masters into the internship. You are constantly like tested, and you have to like have your own willpower, and your own passion should like be greater than the challenges, like being scared or being fearful of failing should be like not the main issue. Your passion should push you, like just move throughout. And also you need to be very resilient, because you'll encounter a lot of challenges, but you just have to be resilient. You will come past that phase where you are like, okay, everything is difficult here, it's difficult. You get to a point like you get so used to the difficult things that when you encounter something that's easy, you're just like not sure. You become suspicious. You're like, okay, this has been like a difficult like journey. So now how are things like getting better? But it does get better. Like once you finish your internship, you will be fine. You'll be set. You will find opportunities, or they will find you. There's always going to be opportunities finding you, especially now that neuropsychology is like, you can register as a neuropsychologist with the HPCSA. There are plenty of opportunities, although not in public hospitals. They're not there. Government hasn't officially like open posts, but you must put yourself out there. I feel like people stay in their bubbles for so long, but if you actually like put yourself out there, put your own knowledge, put your own skills, and explore different things, go to different like functions, network with people, go to like the talks research wise, make sure you attend all these neuropsych conferences, make sure that you actually build like important networks with people in your class, or even your lecturers, your supervisors, so that they can actually vouch for you and your work expertise and your work experience. They know that this person is trustworthy, they're a good clinician, so we will actually recommend them for stuff in the future.
Thank you so much. Awesome. I wanted to ask, and I'm glad you touched on it, beside hospital, where can a neuropsychologist work?
So I think the main area is research at current, like especially in South Africa. I know many work in both settings, and I would like to also work in both settings. Like you have like work in a hospital, private or public, and then you work as like a researcher or in a research institution like the Neuroscience Institute. You can work for a different research group, like a specific research group. Maybe if you like epilepsy research, then you can join that group and be part of the people that build the knowledge about epilepsy in that institution. Or I think some people venture off and work at like memory clinics. I think like there are some clinics that are very specific to certain conditions, like maybe epilepsy or dementia, like clinics that are specific to different conditions, or NGOs that are specific to those different like conditions. Just help out there, maybe like provide assessments. But I'm not sure what that entails because I haven't like met someone who worked in that field. I mostly know the researchers and the clinicians.
Okay. I usually tell people if you are not into research, stay away from research psychology.
Yes.
And if you don't like working with learners, students, stay away from educational psychology. And also, if you don't like psychopathology, being in psychiatric ward, stay away from clinical. For people who are interested in neuro, because we don't know much about it, are they typical environment that this you can avoid? What can you share to tell people if you don't like this, stay away from neuro, stay far, because you don't want to find yourself where you don't want to be?
Yeah.
Anything you can share about that?
Yeah. Just like you said about psychopathology. If you don't like neuropathology, then you should stay away because you will always encounter something wrong with the brain. And it might not come across to you as something that is like expected. Sometimes you meet the most interesting people in your life, and you need to be able to like understand them and actually like communicate with them without like pathologizing them. You need to like be a people's person, I guess. Yeah, I feel like if you can't work with people and you are scared of neuropathology, then you stay away from the whole field because, yeah.
And then is there a particular age group that you can say you work with mostly, or is it across?
It's across. It's across.
Okay. Okay. No, Superman. Ms Nwabisa Mlandu, thank you so much. I really appreciate your time. Is there anything that you wanted to share that I haven't touched on, that you feel like you just need to share this?
Nothing at all. All I can say is that people can still like reach out on LinkedIn, like if they have questions, because I know they always reach out there, and some are usually scared to reach out, like to ask, but I'm always like comfortable sharing my experiences about neuropsychology. So if anyone has questions, they can always just reach out on LinkedIn. Yeah.
Okay, thank you so much. I think what I will do, I'll also put your link to your LinkedIn below this video. I can't remember how your LinkedIn profile looks. Some people have got open to connect. I don't know if yours open for network. I don't know if yours has that as well. But I must also say we met on LinkedIn and you were very helpful. So thank you so much. I really appreciate for sharing this. I think neuropsychology is not as common as internationally. It's still a bit vague. We don't know much, and there's not a lot of opportunities about it in South Africa. So what you shared is very, very helpful, and I really appreciate that. And I'm sure those who want more information will connect. They can put comments as well. I'll be able to where I can respond, share them with you as well for feedback. So thank you so much. I really appreciate your time. All the best with the board exam, your career path. I'm hoping one day we can make a follow-up interview, maybe 5 years from now, to hear more about the field and how it has been going.
I would like that a lot, yes.
Thank you so much. Enjoy the rest of your day.
Thank you so much for the opportunity and enjoy the rest of your day and all the best.
It's a pleasure.